All right, so welcome everyone. This is the Wayne County Health Catalyst for COVID Care Health Literacy Training. We're really excited that you're here to join us today. We're going to do a lot of talking about health literacy. But before we begin, we do have a pre-session evaluation. If you're able to, I know some of you are trying to balance things. We would appreciate if you could go ahead and participate. So you can either scan the QR code or you can Maya put the link in the chat, so you can also get it from the chat. And we're going to actually pause recording and give you about 5 minutes to let people join and let you finish that evaluation. Thanks, Ashley. Okay, we're going to go ahead and get started with today's training session. If you're able to stay on camera, of course, that's great. We appreciate it. If not, that's fine too. If you're not able to come off mute and you have a comment, you can just put it in the chat box and Maya will monitor that for us. So my name is Carolyn Custer. I'm the project director of the health literacy portion of this grant. So I was the one who developed the materials and with the help of a great group of people as well as Miss Maya. So go ahead, Maya.
My name is Maya Thompson. I'm with the Michigan Community Health Workers Alliance, or MISHWA. I am a certified health education specialist, which is very similar to the CHW certification. I kind of explain it more as like program planning, assessing needs and capacity, research and evaluation of different programs. So kind of on the higher level of what CHWs will use right on the ground.
Thank you. All right, so our agenda, overview of health literacy. We'll talk about 5 interventions that we can use with our clients to improve health literacy. Take a short break, and when we come back, we'll talk about just 2 strategies specifically for vaccine hesitancy. There are some interactive components. Maya and I want this to be as engaging as it can be, so please let us know what your thoughts are. Learning objectives describe health literacy as a determinant of health, and then we'll talk specifically about CLAS, which is culturally and linguistically appropriate standards, and some strategies for culturally competent care and public health messaging. And again, at the end, we'll go through some strategies to decrease vaccine hesitancy. All right, that's a lot of words. Who here has seen this picture before? Okay. So we're going to start with this discussion with health equity, right, and health disparities. We can't talk about health literacy without talking about it from the lens of health disparities. And this is a very well-known illustration that basically is showing the difference between equality and equity, right? So equality, everyone's treated the same. Equity, people are treated fair and impartial to get the desired outcome, which is seeing the game. So health equity is the same thing. Everyone has a fair and just opportunity to have the highest level of health. So this picture, I don't know if anyone's ever seen this, but I liked it. It takes it one step further, right? So this concept of justice, where we talk about removing the inequity that was causing the disparity in the first place. And so by doing that, and that's kind of the social justice work that we're all working on, right? To improve the system, to make it more equitable. So this is just the concept of justice. And I do love the giving tree. So I show this slide as well. You can kind of see, from this illustration, inequality, equality, but is it really equitable? And then equity, making accommodations, and then justice is kind of removing the barriers that were there in the first place. So social determinants of health, right? So everyone that is community health worker and your training and whatnot, I'm sure you've learned about this. But health literacy is a social determinant, right? So these are the things that influence our health that are not the things that we receive with our doctor, right, in our clinical care. So 20% of health might be what you do at your doctor's office, but the other 80% is all of these things that impact health. So we know, where you live, where you work, the neighborhoods, the surroundings, the environment, all of these things have an impact. So we have to talk about it with that lens as well. So health disparities defined as the preventable differences in the burden of disease, injury, violence, or opportunities experienced by socially disadvantaged populations. And like we just talked about, factors like health inequity, social determinants of health, these are things that impact health disparities. So what I was going to get into is something like as easy as diabetes. If we think about the rate of diabetes in different populations, there's a different level. And those are the things that we're talking about with health disparities. Systems designed with structural racism is a big thing in Detroit, and we need to acknowledge. Health literacy in Wayne County, who is familiar with redlining? Does anyone know what redlining is? And would they like to come off and tell us what you know about it? Does anyone want to share by chat or? And if not, that's okay. So redlining is something that it was a policy, right, that was put in place in 1939. You can see right here, this is the actual map of where the red line was. And it basically segregated certain parts of Detroit and also people outside, depending on your race and color and ethnicity, you could get a home loan outside of this part of Detroit, right? So the areas that were the hardest to live in were where people of minority tended to end up because of this policy. So we have to acknowledge that almost 100 years ago, things were put in place that impact our access today. And those are things like access to healthcare over the years, access to good education over the years. Everything that this policy started, has an impact even to this day. Any questions about that? All right, I'm going to turn it over to Maya.
So today we're going to be talking about like health literacy and how we can overcome limited health literacy in individuals and organizations. So we're going to kind of start off by trying to get a background on what you guys think health literacy means or what your knowledge of it is currently. If you guys want to come off mute or drop it in the chat of what you believe health literacy means.
Any ideas?
I think we've got a couple.
Is it understanding like how to stay healthy for yourself or to seek out medical assistance when you need it?
Absolutely. Any other thoughts? All right. Do you want to move forward, Maya? Sorry.
Virginia said finding care.
Oh.
Yeah, but we can move ahead. So there's a couple different areas of health literacy. So the first one is personal health literacy, which a lot of people know, which is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And then Fatima said in the chat, the language you use with a patient so they can understand. Absolutely. So I'm going to let Dr. Custer take over the Healthy People 2030 discussion.
Okay, so, every 10 years we have this thing called Healthy People. It's like 2010, 2020, 2030. And those are nationwide goals. So goals for the health of the nation. And in 2010 and 2020, personal health literacy was one thing that we were working on as a nation to improve. But in 2030, they actually added another definition, which is organizational health literacy. And this is the meat and potatoes of what we're talking about today. How do we communicate in a way that improves health literacy in our patients, right? Or in our organization, make things easier so that we can achieve health because we understand it, right? So I'm going to turn it back over to Maya.
While we're going through this, there's a couple different components to health literacy. So the first is skills and knowledge needed to interpret health information that is being given. So literacy is the reading, writing, basic math, speech, and comprehension. And then there's numeracy, which is understanding how math is being used in the real world and being able to apply it to make the best possible decisions. And then factors that influence health literacy are complexity of health information that's being distributed, the language of the person that you're talking to, age, and then their state of health. So if they have any anxiety or illnesses, and then their cultural background as well. So the way that health information is communicated by health providers is a huge factor that impacts health literacy. And this is kind of the same thing. We talk about different individual factors and system and professional factors that influence health literacy. So there's a couple different impacts for people that have limited health literacy. So they're less likely to use preventative health services such as pap smears, mammograms, colonoscopies, vaccines. They're less likely to effectively manage their chronic diseases. They're more likely to have poor medication adherence and higher rates of hospitalization and use of emergency services. Typically can have a higher mortality rate, and then they report a sense of shame about their health literacy levels. And then lower health literacy is associated with higher healthcare costs. So impacts on the community for limited health literacy are missed opportunities for services such as free vaccines and those preventative screenings we were talking about, a lack of preparation for emergencies such as severe weather or different evacuations, missed warnings regarding environmental health and safety, such as contaminated water, and then misunderstandings about public health warnings about food safety, so recalls, everything like that. So when we're looking at developing health education materials, you see the average reading level of adults being at an eighth to ninth grade level, but most materials that are distributed and created right now are at a 10th grade level or higher. So while we're creating these, we want to look for the best reading level for everybody to be the most inclusive. So we want to look at that 5th to 6th grade reading level. And then when you are with patients, clients, or anybody, you want to look for red flags for their low literacy. So frequently missed appointments, incomplete registration forms, non-compliance with medications. They're not able to read medications or name them or explain their purpose. They can't identify pills by reading the label. They only do it by looking at it. They're not able to give a complete and coherent history of their health. And then they ask fewer questions is a huge one. If they're not asking questions, they don't really know what kind of questions to ask. And then there's also a lack of follow through on different tests and referrals.
So a lot of times with the two slides, reporting a sense of shame and asking fewer questions. You know, have you ever been in a room with a doctor and they're just talking medical jargon and the person doesn't understand, right? So they're just nodding. Do you have any questions? No, because you don't want to report that you don't understand, right? So that's a big problem for a lot of people. All right, using a universal precautions approach. If you're in a healthcare facility, you should know about bloodborne pathogens. Does everyone know about bloodborne pathogens? So basically, you know, in medicine, we can't tell just by looking at someone whether or not they have HIV or hepatitis B or any bloodborne diseases that can spread via blood. So what do? We assume a universal precautions approach, meaning if you see blood or liquid or bodily fluid, you're not going to touch it without protection, right? So in the same way, you can't tell a person's level of health literacy just by looking at them. You can't tell it by their job. You can't tell it by their education. People are very highly educated engineers that might not know a single thing about health, you know, so it's just best to assume a universal precautions approach, meaning just assume everyone has difficulty comprehending health information. And what that does is it forces us as providers to communicate in a way that everyone can understand, or that your population that you're serving specifically can understand. And so we use this approach to simplify communication, obviously, confirm comprehension, make sure that understanding is there. It really does make the healthcare system easier to navigate and support our patient efforts to improve their health. Okay. So this crazy slide shows what a health literate organization looks like. And the point of it really is, in order to be a truly health literate organization, it becomes a priority for everyone, all the way from the top down to the patient, right? There's training involved when you get onboarded. There's making sure that everything's easy to understand, materials or social media. There's a lot of different components involving the patients to look at things and say, is this good for you or not? Those are just some of the things. So this is what it looks like. All right, the first interactive component. Does anyone want to share a time? Oh, sorry, Maya, I just took right over.
You're okay. So if any of you guys would like to share a time when having a low health literacy level has impacted you or a loved one's or a patient or client's ability to be healthy. Anybody have any examples that they would like to share out?
Any family members maybe had a hard time understanding their care instructions?
I see this a lot because I'm in Hamtramck, and we were actually, I'll go with this one. So we were actually offering a class for those who had children, and the parents were really concerned, thinking that the information, like it was an information, like we wanted information about their kids so it could be reported, versus the fact that it was a class that just to help them help their children be healthier.
That's an interesting example.
Yeah, they were completely freaking out, and they were like, "Oh, is this going to be reported? Is it going to go against me?" And we're like, "No, it's to actually help you be healthier." So it was a translation type literacy barrier.
Mhm. Anyone else?
Anybody have?
All right, we can go ahead and move on.
So we're going to look at some evidence-based interventions and strategies that you can use to increase personal and organizational health literacy levels, and these can be used to create that health literate environment that we were talking about. So the first one is clear communication. So again, like we kind of mentioned earlier, like everybody's been in an instance when you've been in a doctor's office and you don't really know what they're talking about. You just kind of nod your head and say yes, and it makes you feel uncomfortable, unheard, all of these. So making sure we're clearly communicating with people. So greeting clients warmly, making sure we're making eye contact if it's appropriate, listening carefully, using plain and non-medical language, using the client's words, making sure you're slowing down, and then limiting and repeating content, being super specific and concrete, maybe even showing graphics or demonstrating how it's done, and making sure we're encouraging questions. So a couple different things to consider when you're communicating health is these 7 different aspects. So making sure people will trust the type of information or what source you're putting the information out with. Is what information is necessary to put out and how will people find it? How relevant is the information? What are the conditions that surround and affect the audience that you're communicating to? What are the people's ability to act on the information and what are their barriers? What will the audience think about the information and what will inspire them to act on it? And then how will people respond and what can we do to stay engaged with them and help support them as they continue to take action?
Thanks, Maya. So we're going to send these slides. So if you are going to plan a health education campaign, come back to this slide and ask yourself these questions and make sure that, you know, it's good communication. Plain language. I'm sure you've heard about plain language before, but if you haven't, of course, we want to try to avoid medical jargon, right? Instead of using medical terms, we want to try to say things as clearly and in as plain language as possible. So even something like coming to an appointment, right? You want to just say the time. You don't want to say 20 minutes to 10. You can say 9:40. It's a lot easier to remember 9:40, right? Lot less confusing. So just in one of these things that I always bring up every time is the word diet. So if you ask someone, what is your diet? They may think you're asking them, you know, like, are you on Jenny Craig or Weight Watchers or Atkins? But in fact, what we just want to know is what do you eat, right, every day? So make sure that you are using these types of things rather than these words that are a little more confusing. You just want to be clear. So your COVID test is positive. So we had a health fair where we were testing people for COVID and someone came back positive and we let them know and they actually thought that was a good thing because positive is a good thing usually, right? And so we had to explain, no, that's not. And what we ended up doing is just changing what we were writing to you have COVID or you do not have COVID. It's very clear to understand that, right? So there's just have to adjust your language with the population that you're serving. All right, health literacy strategy number 2. Maya, is this you or me? And why do I always forget this slide?
I think
It's
this one
me.
is you.
Okay. So clear communication is very, I mean, it sounds basic, but it can go so far in building rapport and building relationships. The next strategy that we're going to talk about is using effective materials. So like Maya said earlier, you know, a lot of health education materials are at the 10th grade reading level, when in fact the best should be around the 5th to 6th. So let's do some tips. Like I said, you can check the readability, and we'll give you some websites to look at with easy to understand materials later on in the presentation. The purpose is clear, right? We don't want to have information overload. We want to make sure that there's a clear reasoning for the material. Like I just said, avoiding those medical terms, breaking material up into chunks rather than just having words all down the page. That's hard to read. Identifying an action item. If you want a material to be effective, you know, you'll set a goal, you'll write it down. There'll be something, you know, what's the next step? Why are you telling me this information? What can I take from it? And then using visual aids effectively, you know, different pictures or clip art or whatnot. And then be aware of confusing numbers. Statistics and whatnot are confusing typically, so just avoid them. So now we're going to do a little interactive session. We're going to go through some health education materials and we want to know what you think of them. So if you'd like to type in the chat box or just come off mute, let us know what you think. So these first 3 flyers, and I apologize if you're on a phone, are all related to COVID and they're all about children and vaccinations. So the one on the left is MDHHS, the one on the right is the CDC, and the one in the middle is from Authority Health. So if you look at these 3, and there's no wrong answer, which one would be the most effective for you or for your population to convince them to get a vaccine for a child?
I would say the first one, maybe because it's more directed towards kids. Like the colors and the pictures is not a lot of words.
Mm-hmm.
So it seems like it's more directed towards kids, and like, I don't know, it's just eye-catching because of the colors and stuff.
So bright colors, happy kids, right? These are good pictures.
Virginia also said 1 in the chat.
What's that?
Virginia
Virginia?
also said 1 in the chat, yes.
What about this one on the right? If you had your patient in front of you and you had this, do you think this would work or not work for your population?
For our population, I would say no, because we work with seniors and the words are kind of small. So they wouldn't want to look at it because they probably would say they can't see the word.
And that's the point, right? Small words are hard to see, so you have to think about that when you're choosing. As far as messaging goes, does anyone have any other thoughts, or what do you think about that middle one?
I think it depends on where it's being used. Like, for my clients, I don't think it would resonate with the bears on there.
Okay. And that's we get so much varied response because we're all working with different populations, right? So the Hope Academy families, of course, they responded to this, keep your cubs safe. This was a school-based health center. And so again, just looking, is the messaging clear? You know, keep the school year fun going. You know, that's kind of a clear message, like kids like to have fun. Let's continue that. Okay, we're gonna move on to another set. All right, so the next 3 are just I want to show you some examples of not the best or clearest messaging, right? So here we see this booster. We see a message from MDHHS about a vaccine that has multiple asterisks in fine print underneath. Virginia, I see you shaking your head. Tell us what you're thinking.
Okay, so I work at 2 different offices and 2 different locations, and the reading level, like as per discussed, so in the Hamtramck location, I have a lot of clients that first of all don't speak English, so trying to even translate this would be crazy to go over all of this with a client with a translation line. And then especially because everything, like you said, like, you know, there's asterisks and there's like the Pfizer, Moderna, that would be way too much for them to understand. And then, so being that they either cannot read at all, a lot of them even in their own language, and then turning around and at the other location, there's a language barrier also, but it's a higher reading level. This would be okay if they're English speaking.
Okay. Anyone else? Great examples. Let's look at this next one. This one caused so much confusion. They released this, you know, guidance to return to work. And I tell this story every time, I'm sure Maya's sick of it, but I have a friend who called me during this time, and she said, my daughter has COVID and it's day 6 and she's still fever, but her work said no, she can come to work with a mask on. And, you know, it's like, again, multiple asterisks in fine print. And I don't know why this was so confusing, but it really did. You know, are you allowed to go back on day 6 with a mask or not? Did anyone experience any issues with this messaging? Yeah.
We actually simplified it on our door. We just had I think it said fever, and then it said to call, and then it said oh gosh, I want to say then it said no, it wasn't no symptoms. We just made it more simple and then just had the picture. So it was just 2 signs to clarify and to go over with our clients if they did come in and they had symptoms. It was like a picture of a house that we could point to in the multiple languages.
Very cool. Okay, if I could. What do you think about this one? There's no asterisks in this one, but we have some some clip art. We have some very big points that seem pretty important. But then we have all this little, is this too much or is this okay? Anyone else want to share? Do you think this would work for your clients?
I'm just reading a little bit. Give me a second.
Yeah, no problem. So go ahead and read it over. Many times we hear this is overload. It depends on your patient population though, right? If you have people that can understand all this, that's a different situation. But maybe they could even just put the big points, right? And have a link to the website for more information or something like that. What do you think, Veronica? You read it. Would your population be okay with this? Would this make sense?
It does look like a lot. I'm not gonna lie, like a lot of information. I like how you were saying like leave the big points and then kind of just like leave the website there so they can go themselves.
Yeah. Yep. So when we talk about public health messaging, the whole point is to really consider your population and to make sure that it's clear. All right, what do you think about this? This is you, Maya.
Good. What does everybody think about this message? And some head nods.
Oh, I apologize.
So this is actually the poster for the grant. So this was created, I'm not sure if we have any further information on that, but what do we specifically like about this poster? I know we saw some head nods on there, but like, what are some points that you see that you think it would be effective?
I like that it's very diverse in the picture so people can relate to it.
Ashley said it's simple and it provides valid information. It's very simple. I also make a point that it has 3 different avenues to gain more information. So it has a phone number, it has a website, and it has a QR code, because it's something that we do have to keep in mind of barriers to internet access. So if we have a different avenue of being able to call to gain more information as well, that is something to keep in mind. So some additional tips when using health materials is not assuming your patient can read materials, just like not assuming their health literacy level. So when reviewing different handouts, if we want to circle or highlight the most important points to that specific person, personalize the material by adding their names or their medications, using teachback method, which we're going to talk about in just a few slides, to confirm understanding of the information that's being given, and then emphasize the importance of keeping the material so you can refer back to it when you're doing different follow-ups with the patient. And then again, like I mentioned, making sure the patient has internet access when recommending different digital materials, and then obtaining feedback from the patient on the materials of whether or not they understood it, what were some difficult points, so we can always reevaluate.
All right, so clear communication, effective materials. The third strategy we're going to talk about today is teach back. Has anyone ever learned about teach back? Formally or informally? Just kidding. All right, so studies have shown that, we're humans, we forget. 40 to 80% of the medical information is forgotten, and half of what is remembered is incorrect. So teach back is a method to increase that comprehension. It's basically a method that we probably are all using, but it's a way of checking understanding by asking the patient or client or their family members to explain back what you just taught them. So you're going to go ahead and teach them their care plan, right? What they're going to do after. It is a way to explain information clearly. We are not, trying to make the patients feel bad or quiz them or test them. This is really on you as a provider to make sure that you're explaining things clearly. And it really does improve patient understanding, adherence, decrease callbacks, canceled appointments, and improves patient satisfaction outcomes. So just like we talked about with clear communication, and just like we'll continue to talk about through this session, elements for effective teach back, using that plain language, using that caring tone of voice, comfortable body language, understanding, your population with eye contact and body language, and using those materials. Non-shaming, open-ended questions. So avoid asking questions that can be answered with a simple yes or no. So you're going to talk to the client about you're going to teach them about their care plan. And at the end of it, the one thing you don't want to do is say, did you understand that? Right? Because again, we want to make sure that they actually understand. They're not just nodding and saying yes. So if there's a few different conditions that you're going to have to go over, the recommendation is to do teach back in chunks. So chunk out, asthma first, care plan, then do diabetes, etc. You're going to explain it, what they're going to do, use materials, and then say basically, okay, tell me what you're going to do. And if they can do it, then that's good. If they can't, you can try a different way to teach. Maybe sometimes drawing a picture could help, or maybe different materials. And that's what you do. So we're going to start our role-playing portion of the session. So what Maya and I will do is a teach back example. And this is COVID education about Paxlovid. So the first example is not using teach back. We think it's important to show you what we're trying to illustrate. All right, so imagine I'm the provider and Ms. Thompson is the patient, and I'm coming in to talk to her about COVID because she's tested positive. All right, Mrs. Thompson, and I'm not using a handout, by the way, clearly. All right, Mrs. Thompson, you have COVID. I'm prescribing Paxlovid, the antiviral medication authorized by the FDA to prevent severe COVID symptoms in people at higher risk. Paxlovid has 2 antiviral medications in it, 300 milligrams of nirmatrelvir and 100 milligrams of ritonavir. They exert antiviral efficacy by inhibiting a necessary protease in the viral replication procedure. You will need to take each dose twice daily for 5 days. You need to use barrier protection when having intercourse for the remainder of your oral contraceptive pack. Serious side effects include allergic reaction where you may have angioedema of your mouth and tongue, skin rash, hives, blistering or peeling skin, or trouble swallowing or breathing. Also liver damage, so look out for hepatomegaly, jaundice, and pruritus. Okay, so I'll see you back here in 2 weeks. Hope you feel better soon. Do you have any questions? So usually people are laughing by that point, but so the first example, I'm not using anything but medical jargon. I don't even know. I mean, I understand it, but that is not a good example of teach back. Okay, does everyone get that? So now we're going to do it again. And in this version, we're going to use teach back, and I'm also going to use the actual Paxlovid handout that you can print off. So imagine I'm presenting this to her with the handout. Mrs. Thompson, as you know, your COPD and diabetes put you at higher risk for developing severe COVID-19. I'm going to prescribe you the antiviral medication called Paxlovid. This is what a dose of Paxlovid looks like. There's 2 pink pills and 1 white pill in each dose. You have to take the whole packet 2 times a day for 5 days total. Here is some information about taking Paxlovid. I've highlighted the most important things, such as swallowing the tablets whole. And here's a list of medications that you should avoid when you're taking Paxlovid. Are you taking any of these medications currently? Okay. Also, it can cause your birth control pill not to work. So if you have sex this month, please use an additional barrier method for the remainder of your pill pack. Here are some side effects to look out for. The most important thing to look for is liver problems. Please call if your skin or eyes turn yellow, or you get really itchy skin, or your urine turns dark. I've circled the most common side effects. If you do have any of these, you can expect them to last only 3 to 4 days. All right, so I'd like to make sure I explained everything to you. Can you please tell me, how are you going to take Paxlovid and what are you going to look for?
Okay, so each pill packet has 3 pills. I need to take 1 packet 2 times a day for 5 days and avoid these other medications. I can't remember what side effects to look out for.
The big one is liver problems.
That's right. I'll call if I notice my skin or eyes turning yellow, or if my skin gets really itchy and my urine gets dark. Will do.
All right. All right, so that's our example of teach back. Hopefully you see the difference between the two. But just using that technique is it's very helpful. Less questions and calls back for sure. All right. So we're going to move on to our next intervention. Oh, kind of. So small steps to health. So health literacy strategy number 4 is it's an intervention that we did actually through Authority Health. We ended up there's resident physicians at Authority Health, and we did a project where we did health literacy in a laundromat at 7 Mile in Van Dyke. And it was really exciting to connect with people and teach about health. But one of the campaigns that we did was Small Steps to Health. And really, the point of this is behavior change modification. You know, when we're counseling, we're talking to patients, we want them to do the things, you know, that we're telling them, or discussing with them, I shouldn't say telling. So the whole campaign is really, you have to start with a small goal. If we tell our patients something too big, it's really hard to get your mind around and to do the next step, right? So for example, we all know that the American Heart Association recommends 150 minutes of exercise a week, right? And so it's funny because I audit charts and some doctors will recommend 150 minutes a week. of exercise. I said, well, what is that? Can you imagine your doctor telling you, I need you to exercise 150 minutes a week? It's probably not going to happen. However, what if you talk to your patient, you say, what are some ways you can improve your activity levels? Could you put a video on YouTube and like dance in the kitchen with your grandkids? Could you do chair aerobics? It's just meeting the patient where they're at and coming up with a small goal that they can achieve, that's achievable. Does that make sense? Any questions? So one thing we know about small step behavior change, and we're going to talk about motivational interviewing after our break, so we'll have a little bit more on this, but it might not feel like a lot, right? With just one tiny change, but over time, you can have massive improvement. And I always share the story of a CHW who was on a weight loss journey. And she would every day, her favorite TV show was Law and Order, and she would just march in place in front of the TV because that's what she could do. And, after a year, she had lost over 100 pounds. So every day, if you can just walk in place for an hour, while you're watching your favorite show, or even for 10 minutes, right? That's some place to start. It's a place that's smaller and more achievable. So that's what I got to say about small step behavior change and small steps to health. All right, let's keep going because our last intervention is probably the most important of our series here. So I'll turn it over.
So the last strategy is considering language and culture. So as we all know, Wayne County has a mix of populations with different languages and different cultural beliefs. So we're going to begin with a review of class, which is culturally and linguistically appropriate services. So it's a framework to deliver healthcare services, and it's meant to ensure respectful and responsive to patients' cultural health beliefs and preferences and their communication needs. So it's used to promote health equity and reduce different disparities. So some strategies to implement this are the first part of 2 would be language related. So making sure we're assessing language preferences and language assistant needs, and then using acceptable language assistant services and do not use unacceptable. And we're going to be talking about the difference between those two. And then planning for interpreter services in advance, and then provide written materials in patients' preferred languages. Then the second part of this is going to be more culturally related. So respectfully asking patients about their health beliefs and customs, avoiding stereotyping based on religious or cultural backgrounds, and then acknowledging and addressing implicit bias. So with language translation services, we're going to want to make sure that we're using bilingual clinician or staff members whose proficiency has been confirmed. Staff who are trained as interpreters, and then on-site trained medical interpreters, or telephone or video medical interpreter services as they come in. And then we want to kind of refrain from clinicians and staff who are not trained or certified as medical interpreters. You want to stay away from patients, family, and friends, as it poses a problem with patient privacy. Obviously with cultural differences, the client does insist, and a lot of times family is very involved in health. So you want to respect their choice, but also have a qualified interpreter present, just so you can make sure everything is getting translated properly. And then minors should also never be used. And this is an amazing resource developed by the University of Michigan. It is translated written materials, and they have them in several different languages for several different diseases, conditions, tests, and procedures. So I'm sure there's probably a little bit more on that Dr. C wants to elaborate on.
Of course, because I know Ruthie. So they did it was a big project pulling this together. It's not just what you see on this screen. It's literally every health condition possible in multiple languages, and everything is written at the 5th to 6th grade level. Whether it's stuff from other organizations that's been pulled, that's been at 5th to 6th, or they've even created their own information to share. So if you need anything, take a look at this website. Okay, back to you, Maya.
So this is just an example again of that poster that we looked at earlier, but has been translated into several different languages that are very prominent in Wayne County.
All right, so making sure that we assess for our patients' language preferences and making sure that we have qualified interpreters available. Cultural competency is the other half of class. So we're going to talk about that for a few minutes. We understand and we know that religion, culture, beliefs, customs can influence how people understand health concepts, especially when you come to the United States where we have this crazy health system. But we have to be aware of how culture influences health. To be culturally competent, it really relies on what we've been talking about, right? These principles of trust, respect for diversity, equity, fairness, and social justice. And being culturally competent, or cultural competence, is a set of attitudes, behaviors, and policies that allow us to work effectively in cross-cultural situations. So let's talk a little bit about this. There are many different ways that culture can impact health engagement, so we're just going to go over a few examples. Health beliefs. In some cultures, people believe talking about a possible poor health outcome can cause it to occur. So for example, if you wanted to talk with someone about mammograms, but maybe they don't want to talk about that because breast cancer is, if you talk about it, it could happen. So that could be a barrier. Health customs. Some cultures, family members play a large role, so we have to consider that. Ethnic, there may be roles of men and women in society may make a difference on the way that healthcare is utilized. Religious faith and spiritual beliefs may also impact how someone uses healthcare or, the willingness to accept certain treatments. Dietary customs. This is a big thing for me. We all want to use the DASH diet, but if we have a patient with a different culture or background, maybe they're not familiar with cooking the foods that we're recommending. So understanding dietary customs is very important when making recommendations for healthy eating. For interpersonal customs, again, like I mentioned before, it may or may not be appropriate to have eye contact or physical touch. Again, these are things that you need to learn about your population that you're serving and make sure that you respect these things. Addressing implicit bias, this could be a whole lecture series for a semester. We're just very briefly going to touch on it. We all were raised in different situations and we developed this thing called our worldview, right? Like our beliefs about how the world is. And sometimes because of that, we can have unconscious or even sometimes conscious bias. So it's a belief about another group, right? Or a judgment potentially. Understanding your own beliefs and values and customs allows you to become more understanding and respectful. So learning about others, learning about yourself. Your life experience is only a point of reference to compare to and learn from. It's not necessarily better. So it's our job as providers, as healthcare people, to reflect and make sure that if we do have these biases, that it doesn't impact our level of empathy or our manner of communication. So these are all just things to think about. There's a link here for Harvard has an implicit bias test that's kind of interesting for a social science experiment if you're interested anyway. So patient-centered awareness strategies. When you're with with the person you're serving, just remember that race, ethnicity, gender, spirituality, other issues play a role in the perception and use of healthcare. Understanding the community you serve, the different cultures that make up the community, talking with people, gaining understanding of beliefs and backgrounds, developing cultural humility, understanding that your way is not the best, practicing cultural etiquette, which is being respectful of others' beliefs and values, and then study when you have time. The Office of Minority Health, that link there has some great resources and just understanding different populations' health. All right, we're going to do a quick video. It's only a few minutes on cultural humility.
Culture. It isn't limited to race and ethnicity, though we often think it is. It is the set of experiences, family traditions, individual heritage, and community membership that is unique to every person. And it's easy to think we know someone based on our assumptions about their culture. But each person is unique. And culture is not a fixed set of defined rules. If we treat it as such, our assumptions can lead us to create obstacles for others that we may not see.
One of my close friends at work identifies as gender non-binary and wants to be referred to with the pronouns they, them, or theirs. Coworkers, however, continue to use pronouns such as she or her. My friend is afraid to say anything about it for fear of being seen as a troublemaker.
Assuming that we know or understand someone based on our generalizations about their culture can be faulty and dangerous. It can lead us to misunderstanding, miscommunication, and mistakes. These assumptions can leave others feeling like outsiders and negatively impact workplace interactions, educational environments, and patient care.
I had a patient from India who was suffering from anemia. I was talking to her about the best way to get iron into her diet with the assumption that she was a vegetarian. After a few minutes, she asked me, couldn't I just eat more red meat? I could have asked a question about her diet instead of making an assumption about her culture, and the question would have helped me provide better care.
Many of the people with whom I've interacted have basically conflated the term race with ethnicity and sex with the term gender. It seems like everyone who isn't a member of a majority group is just lumped under the term minority.
One of my colleagues told me that he was surprised I'm lesbian because I dress like a woman. It's almost as if he would have been more comfortable with me being lesbian if I looked the way lesbians are supposed to look.
I'm of Hispanic origin and was told that the only reason I was hired here was because I speak Spanish, even though that's not a requirement of my job.
One of my supervisors made it clear that he thinks women should be more feminine, and that when they are confident and express their opinions openly, it's off-putting.
When I was trying to decide which graduate studies to pursue, an academic advisor pushed me toward a math specialty, in spite of the fact that I had no desire to pursue studies in math. He indicated that I might be good at numbers because I have an Asian last name.
Cultural sensitivity begins with the understanding that we can't stand in someone else's shoes, and that culture is as varied and multi-layered as each individual. But while we can't live someone else's story, we can approach others with humility and kindness, with the willingness to listen and understand, by checking our assumptions at the door and believing others when they talk about their experiences. We find the humanity that is our common thread.
All right, I apologize for that last bit. Let's move on. Okay, so open-mindedness, right? Empathy. All right, we're going to do a quick few more slides and then we'll take a quick break. The Body Keeps the Score. Has anyone ever seen this book or heard of this book? All right, what about toxic stress? Has anyone heard of toxic stress? Adverse childhood experiences? Okay, so we understand now how toxic stress or adversity in childhood, and I'm going to talk a little bit more about that in a second, can impact health overall for the rest of our lives. And so this is a hard read. It's deep, right? But Dr. Bessel van der Kolk is a psychiatrist who studied trauma and PTSD for his whole life, and he's a little bit older. And this book is a really good way to understand the concepts of toxic stress and how they impact health. So we're going to do a quick slide right now so I can show you what I mean when I say toxic stress, so you can walk away with a little more understanding. So when we talk about stress, let's take a step back real quick, reset. When we talk about stress, we're talking about that fight or flight feeling. So imagine a bear, right, is running after you. You're like, yeah, you got to do something. You got to run away. That feeling that you get inside where your heart kind of jumps and your stomach gets a little tight and you're kind of jumped up, right? That's to prepare us for the emergency that the bear that's chasing after us. When you get that feeling, there's hormones in your body, right, that are going up. It's helping you get there. And the one that we talk about a lot with stress is cortisol. So we're going to talk about 3 different types of stress, thinking about that feeling that you get when you're stressed. Positive stress is a good thing. This helps kids normally or develop normally. Things like, getting nervous before a test. It helps you perform a little better. It goes up and then you see it comes right back down to baseline. Tolerable stress is when you're in a situation where the stress level goes up. It's a little bit longer to get back down to normal level, but there are things that can protect against this stress, buffers, we call them. So if you're a child and you're driving with your parents and you see a really bad car accident with a dead body on the ground, you're going to feel shaked up and stressed out, right? But your parents can reassure you that you're safe, that you're with them. So the tolerable stress, that catecholamine, that cortisol level comes back down and you feel okay. In toxic stress, the situation is that the cortisol and the other epinephrine, etc., it goes up and it doesn't come back down. It's chronically elevated over time. So things like, and when you're a child, if you witness domestic violence often, or if you're sexually abused, even if you're an adult, things like war or police or fire, sometimes losing a loved one can create situations where you have toxic stress. And so you're chronically feeling that sensation of stress and you don't get it to go back down. So the cortisol levels that stay up, they can actually impact our body. They change our inflammation, they change our immune system, and it can create different health outcomes for the rest of your life. I bring that up just to let you know that when you're with your client, when we talk about cultural competency and cultural humility, you want to keep in mind what their trauma and stress levels have been at, because you want to make sure that you're approaching the situation. I would encourage everyone to follow up with that and learn more. Does anyone know about this, Maslow's hierarchy of needs? Does this look familiar to anyone? All right, so physiologic needs. The whole point of this hierarchy is, again, when we're with the person in front of us, we have to consider basic needs first. We are going to, with being in healthcare, we want to teach patients stuff, right? We want to, for example, mental health. For the pandemic, for example, mental health is so important that we have it. But if we're telling a mom that she needs to go to counseling to feel better and she doesn't have food for her kids that night, or she doesn't have a place to live or warmth, or clothing, she's not going to think about booking an appointment with a psychologist. She's going to think about these things. So when you're with your patients, make sure that you address first the basic needs, safety needs. Once these 2 can be met, then you can start talking about other things. Does that make sense? All right, the last slide before our break. Creating a trauma-informed space. So I just briefly went over trauma and trauma-informed care, very, very briefly. Please follow up and learn more. I give a lecture to graduate students, professional students in med school, and I ask these questions. And I encourage you to kind of take a look at this after and reflect on these things. When you're talking to the person in front of you, do you have bias? Are you able to be unbiased? Have you considered the culture, the language, the trauma? Are you creating a safe place? Does the person feel comfortable? So just really thinking about these types of things when you're working with your patients, you're teaching them all these things is important. All right, it's time for a break. This is heavy stuff. Let's take a break. And we can return back here at 2:12 on the dot. So 5 minutes, 2:12. I'll see you back here. Go stretch.
So we are going to go into some strategies to overcome vaccine hesitancy. So according to the World Health Organization, vaccine hesitancy is defined as a delay in acceptance or refusal of vaccines despite availability of vaccine services. And it's one of the top threats to global health, and there's very few effective strategies available to address the problem. So there's some causes of vaccine hesitancy, or is this you? Sorry. Some causes of vaccine hesitancy, always, are healthcare and socioeconomic inequalities and inequities, lack of public health, effective public health messaging, and then unethical research historically and currently involving ethnic minority groups, as well as structural racism. And then social disadvantages, so lower levels of education and access to high quality and accurate information. And then the growing spread of misinformation, disinformation, and conspiracy theories through different online platforms. And barriers to access, including vaccine delivery time, location, and costs related to socioeconomic inequalities and marginalization.
Okay, so the CDC put this, so everyone, this is our last class. We're so excited. This has been a 2.5-year grant. And you are currently in the last session. So this, we started this journey when COVID was much more prevalent and whatnot. So the CDC has recommended this field guide. I would definitely recommend taking a look at it. It has some great, ways to talk about the vaccine that can be helpful for other vaccines, not just COVID. All right. So motivational interviewing. I thought I had a question, but I don't. We're going to talk about MI. Has anyone learned, either put your hand up or if you've learned about motivational interviewing before? Okay. All right. So just like I've said multiple times, motivational interviewing is something that you have to go back and learn more about before you can just start using it. And you actually, you have to practice it a little bit too. I practice with my family, so that's what I would encourage you to do. It's a way of talking with patients. It's a way of communicating, giving good advice with listening, right? It's designed to increase patient motivation. So what we're talking about with this is interviewing with active listening and listening to what the patient says so that we can help them set up those small goals that we talked about earlier. MI is based on being respectful and curious about just, kind of understanding people and their situations. So let's look at this chart. This is a busy chart, but the spirit of motivational interviewing is that, in the past, traditionally, the doctor was seen as the expert, right? I'm the expert. I'm going to tell you what to do. You don't know anything. And that's kind of how medicine has been. Motivational interviewing is a different way of thinking about it. You're not telling, as a doctor or a provider, you're not telling a person what to do. You're talking to them and you're listening, and you're going to come up with a care plan together, right? A shared decision. And we're going to honor the patient's autonomy. They are allowed to make the decisions of their healthcare. We're not the boss of them. I might have went to medical school and I know a lot about a disease, but I don't know what that patient's life is or what they're going through or all the different factors that impact health. I can't tell that unless I talk to them, right? And learn that information. So motivational interviewing is a different way to communicate, a better way. ORS is one of the models that's used. So ORS starts with an open-ended question. So when you're talking to your patient or client, you want to start with something open. Tell me more about, or explain this to me, or make this clear, rather than those yes or no questions that we talked about early, right? Do you understand? You're always going to get not enough information. So let's say you want to talk about diabetes with a patient. You know, tell me what motivates you to manage your diabetes, or what's hard about managing diabetes. Those are open-ended questions that forces them to kind of talk through things, right? And when you're doing that, you want to listen and you want to affirm, meaning you want to, you know, show the patient that you're actively listening. Things like, it takes a lot of strength to go with what you've gone through. Something like that can be affirming. It, you know, helps them understand that you're listening, and that you're caring. Reflections. So reflections is mirroring kind of what the client says. And so every so often, you know, it's important to kind of reflect to make sure that you're understanding. You might want to say, it sounds like, or from what I'm hearing, it sounds like, you know, you want to make this change, but there's something holding you back, or whatnot. So kind of using their words back is reflecting. And then the last piece is summarizing, saying, okay, we've just had this conversation about diabetes. You've told me, you know, the barriers that you're facing, and you've worked really hard at getting where you're at now. And then you kind of just pull together whatever they've said. And that'll allow them, the patient, to say, no, that's not what I meant, or yes, yes, you know, that is. So it allows them to kind of reflect back. So I encourage everyone to go do some research and watch some YouTube videos on ORS. For vaccines specifically, motivational interviewing, again, we want to start with an open-ended question, and we do not want to assume vaccine acceptance. So just, you know, what do you think about vaccination? Acknowledging the patient's concerns without judging, right? We heard a lot over COVID. We heard a lot of different reasons why people didn't want to get the COVID vaccine. Everyone's valid, right, in their reasoning. The one thing we don't want to do is judge someone else's concerns. We just want to understand. So being empathetic, avoiding criticizing their information source, right? Like, what if they came and said, well, my grandpa told me, or my pastor, you know, you don't want to criticize that information. Instead of doing any of that, just providing high quality information from a positive frame is the best way to go. Community health workers, navigators, people that work, everyone on this call, you are a messenger. You are definitely a very important and vital part of the care team. You're the glue that holds it together. You know, the doctor's doing this, the nurse is doing this. The community health worker can get in there and talk to the patient, make plans and teach and all that good stuff. And so know that, recognize that you are a messenger and your role is important. And then linking the vaccine acceptance, or whatever the thing you're talking about, with the patient's hopes and goals can be motivational. Certainly, you know, with COVID, when we first had the vaccine come out, and a lot of the older people, right, hadn't seen their grandkids in a long time, everyone was communicating through plastic doors and everything. And, you know, one of the things that, you know, if you have a grandma and she says, I really can't wait to see my child. Okay, well, that's thinking about a hope and goal. Hey, you know, you could see your grandkid after you get the vaccine. It may or may not be effective. All right. So we're going to do another example, Ms. Thompson and I. And we're going to do a motivational interviewing example. So in the first, there's again going to be two role plays. The first one's going to be not motivational interviewing. It's going to be the traditional way of, I'm the doctor, I know the best. And then we'll do another way with motivational interviewing. All right. So the traditional approach based on education and counseling. Ms. Thompson, it's important to immunize your child. If not, you're putting him in danger. Do you know there's still cases of measles out there? This disease can be very dangerous. And what about meningitis? It can be fatal, you know. You should update your child's vaccinations since he's already late according to schedule. We can do that now if you want.
I see the urgency, and autism is worse than measles. There are more problems than solutions with this vaccine. It's completely unbelievable to give so many vaccines at the same time.
Studies have demonstrated there is no link between autism and measles. The vaccine's safe, I assure you. You should be aware of the information you're finding on the internet. Giving several vaccines at the same time is safe and not associated with more pain. We should update his vaccines now.
I've heard something else, and not only on the internet. I've read a lot, and vaccination is not mandatory. I can do what I want.
Yes, you're right. It's not mandatory, but you're putting him and other children who cannot receive vaccine in danger. The risk of disease are much higher than the risks of vaccines. If I'm taking the time to speak with you about this, it's very important.
It's easy for you, quick. But what if he gets autism? I'm worried about the risk of vaccines, but you don't seem to be worried about the health of my child.
Of course I am, and I'm worried about the fact he can get diseases that could be prevented by vaccine.
I don't think we understand each other. Let's talk about this another time.
Okay, so in this one, I'm telling Ms. Thompson why she needs to get the vaccine for her son, and she's being turned off and says, no, thank you. Okay, so now we're going to do a motivational interviewing approach. And remember, we start with an open-ended question. Hello, Mrs. Thompson. What do you think about the advantages of vaccination?
Well, I know that vaccines protect children against several diseases that we don't see anymore. My child received all of his first vaccines, but I'm worried that the measles vaccine could cause autism. For other vaccines, I have fewer doubts, but I'm still hesitating.
As you've said, vaccines have reduced disease in such an important way, they're now much less frequent. It's why you vaccinated your child when he was a baby. If I understood you correctly, with the exception of the measles vaccine, the other vaccines seem safe to you?
Yeah, I know it's a good thing to prevent those infections, but about measles, I'm conflicted. I've read a lot of books and articles, and lots of people are worried about the link between the measles vaccine and autism.
So you find it's important to protect your child against diseases when the vaccines are safe, but you're worried about what you heard regarding autism and the measles vaccine. I see that you've done a lot of research on the subject. If you'd agree, I can give you some more information about those studies linking autism and measles.
Sure, I want to know exactly what happened.
In fact, you're right. One study had hypothesized a link between measles vaccine and autism, but this study was fake and the author lost his medical license. More than 500 additional studies around the world have demonstrated there's no link between the vaccine and autism. The frequency of autism is the same in a vaccinated children group as in the non-vaccinated children. What do you think?
So I'm not crazy to be worried about that?
Of course not. You're totally right.
Thank you for taking the time to understand my concerns. I think it's a bit clearer now.
Okay, so using motivational interviewing, I was able to hear mom's concern and give her some additional information that she wanted to hear. So that's kind of the difference between a traditional approach and a motivational interviewing approach. Any questions or comments? Who knows the difference between misinformation and disinformation? Does anyone know? And Robert, hi, I saw your note. Okay, so misinformation, nobody wants to take a stab?
I would say misinformation is information that is incorrect. Disinformation is information that I guess kind of may have gotten twisted or twisted up in delivery.
That's a way of thinking about it. So both information is incorrect, right? Misinformation is shared, but the person sharing it doesn't necessarily know it's incorrect. Disinformation is like a violation, like you're purposefully spreading false material to try to create a situation, right? Thanks, Robert. Okay, the role of social media, we're going to talk about that real quick. We'll talk about providing factual information and using trusted messengers. All right, so this slide is just to show, and this is 2022, I need to update it, all the different ways people get information these days. It's no wonder that there's a lot of variation in the information that we get because there's just so many different places. So what do we do? What do we do when we're trying to advise someone for a vaccine and they say, no, there's a microchip in it, right? I don't want to get turned into an alien or a superhero. Providing factual, easy to understand information is the best thing. And that's what we talked about before, right? Do not judge the source. Don't judge the person for what they've said. You're just going to say, okay, here's some information that I can share with you from the CDC, and you can make your own informed decision. Using trusted messengers. So again, things like, and if we do have another pandemic and we're trying to get information out, using people like you as community health workers, but remember all those commercials when we saw healthcare champions, we saw, pastors, reverends, we saw police, these are the trusted even celebrities, right? People that that people look up to and that can rally people. It's a good thing. And you guys are all, and Robert, you missed my whole spiel on community health workers, but you are the glue of the care team, right? Doctors busy, nurses busy. You're right in there with the patient. You're able to communicate, teach, got that time. Trusted messenger. All right, very quickly. Again, this was put together a couple years ago, so bear with us. But for COVID-19, let's talk specifically just about the new 2 vaccines. So in the beginning, we all remember, I don't know if we all remember, but the very first vaccine that came out was monovalent, meaning it only covered 1 strain of COVID, and that was the Delta. Then remember, I think the next year, the original booster series came out, and it was the bivalent, meaning it covered that original strain as well as those Omicron variants that were really prevalent at the time. So now we have a yearly COVID vaccine. We're not calling it booster or primary anymore. It's just the yearly COVID vaccine. For this year, of course, just like the flu vaccine, they try to predict which strains, will be out there the most, and that's what they put in the vaccine. So it does protect against the current subvariants. There's like 4 or 5 different ones. And really at this point, it's just one, unless you're in a special category, it's just 1 shot and then you're vaccinated. So here's the Pfizer and here's the Moderna Spikevax. Any questions about that? Yeah, we know what we're doing now. We're cruising in this COVID world. All right, so the journey to immunization. We're kind of wrap this up with everything that we've kind of talked about today. Health literacy, right? How can we improve it in our organizations so that we can improve it in our patients? This first step is knowledge and awareness. And then really, attitudes. How are people looking at it? What is their intent? Preparation is for a person that wants to get a vaccine. It's not just an easy necessarily thing. You have to find childcare, you have to find, a ride to the doctor, you got to find all those things. Cost can be definitely a problem if your health insurance isn't covering it, right? Or you don't have health insurance or a situation like that. Point of service, again, for COVID, you had to come back in 8 weeks. It's hard. It's a factor that impacts the success rate. After service, again, kind of some of these different factors to consider. So again, when we talk about vaccination, we talk about any, treatment for care, we have to consider a lot of different things that play into that. Now, Robert, you just got on, so I'm going to share the link for the whole recording so you can watch it, because I really hope that you can enjoy it and whatnot, because we're actually at the end, almost.
Thank you. I appreciate it.
Yep. And Ms. Mai, I'll turn it over to you.
Thank you. So who can share a situation where someone refused to get vaccinated of any sorts due to misinformation or disinformation that they received? And how did you react? Was it an effective reaction? Or if you can't think of a family member or loved one, maybe a time when a patient refused to get vaccinated.
My mom, when COVID was out and they were making all of us get the vaccinations and things of that nature, she never got the vaccination nor the booster shot. And I don't think it was due to misinformation or disinformation. I think it was more so for her because she had already had pre-existing conditions that she was afraid that the vaccine would have had a negative effect on her and her pre-existing conditions. How I reacted, of course, at first it was like, well, you have to get this, you have to get this, you're gonna die if you don't. But after really listening and sitting back and not really trying to push my agenda, I had to listen to her and make her first become client centered. So I had to take off my mom and make it like she was my client. And I had to really just sit back and uh, really just let her not get the vaccine, but was it effective? Was my reaction effective? No, because she never got it. But that's my little spiel on vaccines there.
Absolutely. I think we see stuff like that all the time. Does anybody else have anything else to share? Any other experiences?
Yeah, it's been an interesting time, and I can even say, I remember when HPV vaccine came out. My children did not get vaccinated right away. And they both got it. They're both completely vaccinated. But I was hesitant in the beginning. And I think that COVID was way more quick, right, more rapid and whatnot. So we just have to keep an open mind and use some of the strategies that we went through today, when we're discussing, because, we're going to have another pandemic. If it's not with us, we're going to have something that we have a client in front of us, a patient in front of us that we have to work with, right? All right, so I'm going to turn it back over to Maya to wrap us up.
Right. Summarize kind of what we talked about today. Low health literacy levels is associated with a lower health knowledge, poor medication adherence, increased use of emergency resources for primary care, and increased mortality rates. And all of these impact quality of life overall, and all are impacts of a low health literacy level. So when addressing anything, it's important to use a universal precautions approach and assume all patients have a low health literacy level. And then improving individual and community health literacy levels can reduce vaccine hesitancy and increase COVID vaccination rates. So again, as we've kind of talked about a couple times, the recommended grade level for written materials is that 5th to 6th grade level to make sure we are the most inclusive we can be. And then health literacy strategies can be used to increase patients' understanding about their health conditions and empower them to make decisions and active role in their health. So those strategies are clear communication, teach back method, using culturally and linguistically appropriate services and materials, motivational interviewing, and combating information.
All right, so before we end, I'm going to go a few slides. There's an additional training through the CDC on health literacy if you're interested to learn a little bit more. And I did include all the resources from what we used. The AHRQ, the Agency for Healthcare Research and Quality Toolkit is the meat and potatoes. If you want to review it, it's a really good source. I did include my email and phone number if you have any questions or want to follow up with me. Or Maya, I can contact her for you. And so we're going to end here. If you want to come off, you can. If you have any comments or questions, this would be the time. And if not, we appreciate your feedback. So we put this QR code up again. There's also a link in the chat to get to the post-session evaluation. If you would like, there is a certificate of completion available from Wayne County Community College District, and you'll notice on the post-session evaluation, after the quiz, there's a section to rate the presentation, and then it asks you for like your name, your date of birth, etc. It'll ask you a few things. Wayne County Community College uses that information to create a account for you in their continuing education program. So they use that to award the certificate. If you do want one, you can go ahead and fill out the fields and I'll email it to you within 3 to 4 weeks. Maya, what about the CHW credit?
So if you are a MISHWA member, and I'm not sure if any of you are at this moment, yes, okay, perfect. So if you are a MISHWA member, if you want credit through MISHWA for continuing education, you're just going to go on to, like you would do like one of our live webinars, you go into that online training portal, you'll type in health literacy, find this course, and there's a video attached to it. Obviously, you already attended, so you don't need to watch the full video. So just take that feedback form and those CEUs will be automatically updated in your account.
All right. Does everyone have access that's going to use the post-education session evaluation? Okay, I'm going to stop recording.